Egypt, Prof Mohamed Hamed, Professor of Interventional Radiology, Cairo University, Egypt. Professor Mohamed will talk about HIFU.
Why the sad emoji? The sad emoji. You're happy? I said something really jolly. Why is Monica? She left? Did you meet Greg? No. I met him in the morning.
Good afternoon. It's a pleasure to be here with you. Today we will talk about high intensity focused ultrasound. I'll give a brief lecture about where we stand, what is the situation of non-ablative, non-invasive ablation by HIFU procedure, where we are now. No problem. IT. Stop the sound. I'll give the brief. Sorry for this, it's a technical issue. Of course, now the role of non-invasive interventional procedures like HIFU will be growing on in the next period. Okay? Okay, I'm back. The non-invasive intervention ablation. Yes. The development of treatment mode, the treatment mode is starting with great intervention like open surgery, passing through minimal invasive, and till now, the HIFU in interventional radiology is considered the only non-invasive procedure. It's considered as an old technology at the past century, but the dilemma, how we can carry this power to the tumor safely. The HIFU is different from other ablation procedures because there is multiple action mode. There is thermal disruption, mechanical disruption, microvascular disruption, and of course there is a significant immunomodulation, and even it helps in drug delivery, and can now there is a studies talking about the blood-brain barrier carrying chemotherapy to the brain. The theory, the technical theory, is how to develop a coagulative necrosis at the point, a distance from 12 to 16 centimeters away from the skin, to produce point by point, then line by line, then a volume. And the patient is stable, and the machine is working in different angle to hit the tumor. We have an MR-guided and ultrasound-guided HIFU system. Both of them are used with FDA approval for the technology. The MRI is usually used for brain, like essential tremors, and now starting to use in brain tumors. And the ultrasound is valid for body and peripheral tumors. It's very precise. We produce a nidus of ablation ranging from 1 to 3 millimeter and make it in cumulative effect to produce the ablative zone. Where we are now, we have an FDA approval for many indications: benign prostatic hyperplasia, bone metastasis, essential tremor, osteoid, Parkinson's disease, prostatic cancer, uterine fibroid. We can use it with FDA approval in this indication. Outside USA, we can use it for cancer liver metastasis, cancer pancreas, and osteosarcoma, bone soft tissue tumors, and many indications. The number of patients and the acceptance of HIFU is increasing dramatically at the past 5 years. So we have many indications with many FDA. The total estimated number of the patients treated with HIFU is exceeding 250,000 patients all over the world with many indications. There is many manufacturers talking about the technology of the HIFU by different technique, now exceeding 28 manufacturers. The HIFU treatment is non-invasive, retreatable, no ionizing radiation, high safety profile, no hospitalization. In many cases, we can to next day go to the ward. We must know very well anatomy, proper positioning, surgical approach for different techniques, direction of the power, and we must start with the least power. This assessment is very important. If the distance, the size, the vascularity is lower, you will get better effect and less time and less complication. The technique is very easy. We have accessories of balloon, water balloon, gaseous balloon to push the bowel and to push the organ, and then we put the energy. This study is considered the largest study talking about the famous indication of the HIFU, which is the fibroid. This multicentric study in China in 13 hospitals, talking about 1,010 patients, and they found the efficacy of HIFU in treating fibroid is very high, reaching a success rate more than 87%. And the symptom improvement is significant. And the importance to significant point of improvement is 3 months. There is a reduction of the size of the tumor till 50%, the symptoms improving by 60%. If we can ablate more than 70% of the tumor, of the fibroid tumor, we will get the same result like surgery. And you can see this is a large fibroid tumor, anterior wall, and this is the results after 8 months. We evaluate the fibroid by what we call the non-perfused volume, MRI with contrast. If we get more than 70% of the tumor, of the fibroid lesion ablated, this is as result as surgical treatment. And the size, shrinkage, symptoms, improvement symptoms, the cutoff point is 6 months. This is the most important time we can get all of this. Of course, the other indication for HIFU is adenomyosis, and the fibroid application is with nice approval in United Kingdom, FDA, USA, or whole Europe using the fibroid. Of course, Asia is the most common country. The adenomyosis also is very important indication, either focal form or diffuse form. There is many studies talking about this. The other indication is solid malignant tumor. The solid malignant tumor is very important, especially in cholangiohepatic tumors and pancreatic tumor. The pancreatic tumor, we're facing a problem because till now, with all researchers, with all effort, we can't control the progression and incidence and the treatment of pancreatic tumor, and of course the HCC incidence and the colorectal and hepatic metastasis increasing. So we need to help in this issue. The ultrasound-guided HIFU for liver tumor and for pancreatic tumor till now is the only approved technique to use it. This studies talking about the application of HIFU in liver from Japan, from Korea, from China, from Italy, from Spain, from Germany, and with very good result. Of course, the HIFU is not the primary technique we will choose in all cases, but in some cases, like these cases, like this is very central cases related to the IVC and portal vein, what we can do, except HIFU, if there is a metastatic lesion insinuated by the hepatic vein, what we can do, except HIFU, I am talking about the ablative procedures, thermal ablative procedure. Of course, we can do an injection, but I am talking about thermal. If we have like these cases, very central cases, the HIFU is suitable in combination with TACE. And we have an experience of this in our center in Egypt. If we do the TACE and after 5 to 10 days doing HIFU, it's marvelous technique and giving us a very good result. Which technique can affecting the metastatic lymph node in higher tumor like pancreatic or liver, the HIFU play the role in this issue. And this study is very important. This study from Hong Kong Queen Mary Hospital, and this is the hospital putting the Hong Kong classification system for HCC. They're talking about 3-year follow-up in the small sized HCC, and they found no difference between the HIFU and radiofrequency in survival. Of course, the local regional treatment, especially the hyperthermia and the HIFU, will increasing the role with introduction of immune therapy, and now we're starting in the practice to do the ablation or embolization with adjuvant immunotherapy. Of course, the pancreatic tumor also is a big dilemma. If we have this small lesion with metallic stent, the IRE is very difficult, the operation is not valid. The HIFU will be the feasible and easy way to treat this patient, and we have a lot of cases all over the world, and there is many centers in Europe, in Bonn and Frankfurt, just working for pancreatic tumor and studying this. We published also a study about the guidance of vascularity to safely treating the pancreatic tumor, because we haven't contrast media in Egypt, and this is very efficient and very safe with no trauma to the vascularity. Of course, another issue, not only the tumor ablation, the pain management in cancer pancreas, and the HIFU is extremely painful in controlling the pain, reducing the pain scale, and improving the quality of life in many patients. This meta-analysis talking about the studies, this is from Amsterdam, talking about the efficacy of the HIFU, which machine, all of the machines are ultrasound guided. There is significant improvement of pain. It's about more than 87% of the patient improving the pain score. Of course, there is another indications for the HIFU, but this is tailored and case-by-case study, like primary osteosarcoma, and this is very important now with introducing of the immunotherapy and the introducing of systemic treatment. This will play a role, very good role in treatment of the osteosarcoma, and we starting to do this, but with very limited number, and I think this is need a lot of studies. Of course, the metastasis is very, very, very efficient, because we can hit the periosteal lines, and we can nerve ending at the periosteum. This will reduce significantly the pain. There is some cases with very difficult situation, like chest wall tumors, like rep diseases. But of course, the HIFU play an important role to ablate this lesion. Yes. Does it really work? Yes, it's work. This is one of the future tools in the to treat the patients. And this is our center in Egypt. my colleague, Dr. Fauzi here, we are starting to treating about 600 cases with different indications, with good results, excellent results, and acceptable results in some cases. Thank you very much, and I hope this is
It's a real pleasure for me to invite Professor Stefan Müller-Holzbeck, professor from Academic Hospital of Kiel University, Flensburg, Germany, to speak to us on the use of fusion software for tumor ablation. Is this a luxury or necessity?
Thank you very much for this kind introduction, and thank you very much for the coordinators of PERS for inviting me. How about this ultrasound, as you might appreciate in this